So, if you've been practicing with me for any length of time, you're probably aware that I'm not the biggest fan of stretching, especially stretching the neck for reasons that I will explain in your practice. However, there are ways that we can use some gentle mobility exercises to start to unravel that tension, discomfort, even pain in the neck over time. So this practice is all about teaching you how to use stretches in tandem with breath and awareness to actually get some relief. So let's begin by setting up some props. For this practice, you'll need to have a very firm yoga bolster, or you could use some really firm pillows around the house. If you don't have a bolster, I would even suggest maybe a couch cushion. That'll be about the right thickness and density. You'll also need a blanket eventually for resting your head on. We're going to set up the props so that your bolster is now latitudinal on your mat. So that means the short edges of the bolster are against the long edges of your mat. And then your blanket is going to go to the other end of your mat because your head is going to rest there. So think about it this way. In a moment, your head is going to be resting on the blanket and your feet are going to be standing on that bolster. So go ahead and turn yourself so that you can lay on your back with your head on the blanket. Slide that bolster under your thighs before you come down to your back. And then as you come down, you'll just bend your knees and stand your 2 feet onto that bolster with your head resting, for now, on the blanket. And with your feet standing on that bolster, you'll check that the bolster is not so far away that your feet are sliding off, and it's not so close that it's hard to get your feet on there. Just find that sweet spot so you can rest your feet easily onto that bolster. And then go ahead and send your 2 legs out long over the bolster. Just taking a few moments to center. Starting to deepen the breath just a little bit. Feeling the breath smooth out a bit. And as you breathe in, imagine that the top of your mouth, the palate, soft palate, is rising up as you breathe in. And it's rising up as you breathe out. It's a weird feeling. Let me give you another shot at it. Imagine that the soft palate, the top of your mouth, is rising up as you breathe in. Is rising up as you breathe out. One more. And then just gently start to turn your head side to side. And for now, my friend, don't turn your head so far that you encounter any of that tightness or discomfort, okay? Keep the head turns really gentle. And for some of us, especially if you're kind of in a flared up place with your neck right now, that may mean that your head does not turn very far at all, and that's okay. That is okay. We all have to practice exactly where we are. That's the only way this works. And just take note, how far does the head turn in each direction? And it's probably easier on one side. Okay, and then just bring your face to turn straight up. And please do stand your 2 feet now onto the bolster. Stand your 2 feet back onto the bolster. The blanket, which was under your head now, just use your hands to slide it back. So it's back, it's easy to grab when you need it, but it's no longer under your head for now because it's going to disrupt the rhythm of this movement as we progress. I'd like for you to take a few pelvic tilts now. So the first time you tilt, let's feel the low back start to pick up away from the floor and your tail tilt forward, almost like you're tipping your pelvis toward the bolster. And then your low back is going to press into the floor and your tail is going to rise up away from the bolster, almost like it's curling away. Let's do a couple more and keep the movement really minimal and gentle for now. And try to release any resistance that the rest of your spine might have to the movement. So in other words, don't hold the top of the spine very stiffly. Allow them to actually respond to the movements of the pelvis. So when your lumbar is peeling away from the floor and your tail is tilting down toward the bolster, your chin will probably tuck, like you're making a double chin, right? And when your lumbar presses back down into the floor and your tail is curling away from the bolster, your chin will lift far away from the chest. And you might even exaggerate that a little bit. Maybe find a little stretch in the front of your neck. And then on your inhale, you'll feel your tail tilt down to the bolster, your chin tuck. And on your exhale, your lumbar pushes into the floor and your tail lifts and your chin lifts. Let's do a few more, and it's time for you to start to kick the tires a little bit. See if maybe you want to really augment that double chin and that big lift of your lumbar away from the mat. And see if perhaps on the other side, when your tail is lifted, you might want to draw your chin away a little bit more from your collarbones. Do two more. And see if on this last one you can come back to that soft palate lifting inhale and exhale. Soft palate lifting on the in and the out. Good. And then come back through to a neutral position. So all the spinal curves are represented. The lumbar spine and the back of the neck are moving away from the floor, and the parts of your spine which are pressing down are your sacrum, which is behind your pelvis, and the upper back. And go ahead and bring that blanket back under your head now. Please do have the blanket pretty low. I don't want your head super lifted. I want it actually pretty neutral, but I'd like for you to have something soft and comfortable under the back of your head. Now turn your face very gently to the right, please. Let your face turn to the right. And again, let's not poke into discomfort yet. And come back to the center. So you're going to turn your face to the right, not poking into any discomfort. That means, my friend, that you have to stop, okay? It also might mean that you initially find the place where you can poke into discomfort only so that you know where to stop before you get there the next time, okay? These sensations that your neck is producing are not bad, okay? The neck is an extremely sensitive place in the body. In fact, you have more sensory architecture in your neck than just about anywhere in your body. So that tells you how important evolution, the process of evolution, deemed the neck. Okay, so the next time your face is turned up, you're going to keep it turned up and just rest. Just rest for a moment. Notice any sensations that are coming up. Notice any feelings that are coming up. A feeling is a sensation plus a thought. Maybe you're feeling a little discomfort, almost like you've poked a hornet's nest, these sensitive places. Please don't try to push those sensations away, and please don't overreact to them. Now is the time to feel all of the sensations. Every single one of them are valid and important. Every single one of them has a right to exist in this moment. Now I'd like for you to Keep the tip of your nose pointing straight up. Keep your chin pointing straight up to the ceiling. Keep your heart pointing straight up to the ceiling. It won't be easy. And push down into your left foot like your left hip wants to lift. Now this movement is going to tilt your hips a little bit, but you've already committed to keeping the chest, the heart, the chin, and the nose pointing up, right? And then let that left hip drop back down to the mat. Okay, nose, chin, heart, point straight up to the ceiling as you push into your left foot. Your left hip leaves the floor an inch or two. And of course the hips tilt. The hips tilt because the right hip isn't really lifting at all. You're just kind of rolling into it a little bit more. Let's do it a few more times. So your chin, your heart, your nose looks straight up, even your eyes. And you might notice that holding the upper body and head in a stable position as the hips move creates a fair amount of tension. This is normal. Your body comes standard with this capacity. Don't be afraid of it. But I know, my friend, that you have learned to fear this tension. And what I want you to know right now is it's okay. It's safe for you to feel this. This is normal. This is normal. However, when you did your pelvic tilts earlier, I asked you to release any tension along the length of the spine. And now I'll ask you to do that again. So as you push into your left foot, your left hip turns to the right. So do your ribs, your chin, and your nose. Okay, so now you release all of that holding. You'll let your head turn with your hip. And then when your hips come back to the center and your knees point up, when your feet are standing squarely on that bolster, your face turns up. Let's do it again. So push with the left foot, the hip tilts, the heart, the nose, the eyes, they can't help it. They just go with the rest of the body, right? Imagine that you could steer the movement of your head and neck only with your hip. Try it. If it's okay for you to keep your eyes open, I say do it. And let your eyes track with the direction of your heart. So if your heart is pointing up, your eyes are pointing up. As your heart turns to the right, your eyes slowly turn to the right, and you might find that it's hard, that your eyes skip around a little bit. That's okay. You'll get better at it, I promise. Okay, next time your knees are pointing up, with your left hand, take a hold of the side of your mat. I want you to get a big handful of your mat, and then slide your hand down a little bit further so your left arm is fully extended. There's absolutely no bend in that left elbow at all, okay? In fact, you might already be feeling a little stretch in the shoulder because your hand has already created a traction effect by holding so tightly onto the mat. Now, as your hip drops, as your hip tilts, your face and your heart turn, you're not gonna let go of that mat. You're gonna keep a hold of it really tight. And then you're going to come back to the middle. So you'll feel less tension on the shoulder. And let's do it again. So your hand is holding, got a big old handful of that mat. So as you turn, you're going to create a little traction across the shoulder. Also, some of the more sensitive regions of the neck. So we're looking at upper trap, scalenes, and SCM. When my clients come to me with neck pain, these are often so sensitive. So sensitive. So you might be feeling some sensations here. Please tell yourself that it's safe for you to feel these sensations. They come standard with your neck. Your sensations, however, are amplified if you've been having trouble with your neck. That means that your neck is way more sensitive. So we just have to train the body not to be so sensitive. To say, oh, that's safe for me to feel. Oh, okay. Let's do two more of those. And hopefully you get a nice little stretch, but I would like to caution you from finding a super deep stretch. That's probably not the most productive thing. And next time your knees have windshield wipered to the right, your hand has a nice handful of that mat and it is holding tight. I'd like for you to pull with your left arm, drawing your left shoulder up towards your left ear. So now you've created tension, lots of tension. I know tension is the enemy, right? I know it's scary, but tension is not the enemy. It's your friend. It's part of the function of your neck. Shrugging that shoulder up to your ear for one more breath in and out. And then keep the windshield wipers, but release all of that extra tension, right? Allow the left arm to rest. You can let go of the mat completely. Maybe shake out your fingers. Yeah, because they may have gotten a little bit tired. So your face is still turned to the right. The knees are to the right, kind of in a windshield wiper, right? On that bolster. Now, just push down into the left inner ankle so that your hips tilt a little bit more to the right and your face turns a little bit more to the right. And then just release. Let everything go. Inhale, feel the soft palate lift as you push down into that left ankle. So you're feeling yourself tilt to a very small degree. Okay? And then release. Feel soft palate lift as you tilt. And by the way, hopefully you're feeling your hip is turning everything. Your neck isn't doing much at all, although you might be feeling lots of sensations there. Okay, last time you're going to push. Now try this. Keep the push down into your left inner ankle and the face turn to the right. But let your left shoulder blade get really heavy, and maybe a little bit further down toward the bolster before you soften completely and allow that left shoulder blade to totally settle into the mat. Let's take a few breaths here. And if your left thigh, your left knee aren't so crazy about this, you can always throw a block under that left knee, or you can just bring your right foot under it. Sometimes that's all you need. So I've been working with people who live with neck pain for a really, really long time. And at some point, everybody always asks me for a stretch. Show me how I can stretch my neck a little bit better. And usually I refuse. And here's why. Your neck is stiff and tight. Everything in you is saying, stretch it. It's a compulsion, right, to stretch that neck. And yet, if you've tried it, you've probably found that it doesn't work. You might feel a little relief as you're doing the stretch, but as soon as you let go of the stretch, you're back to the same thing, or maybe even feeling a little bit worse. The fact is, the body has no sensory anatomy. Zero sensory anatomy capable of giving you the facts. So even though your body is saying stretch, that doesn't mean it's the right thing to do. For example, the most common reason for a headache is dehydration. But nothing about a headache says drink water. So this is just to help you understand that even though your body wants a stretch, it's not always the right thing to do. Let's take 3 more breaths here. Feel the soft palate lifting up as you breathe in. Lifting up as you breathe out. Lifting up as you breathe in. And out. Take your hands, one to each side of your head. And as your knees come back up, your feet stand on the bolster, your hands turn your head back up as well. Turn your head back up as well. And maybe you'll have to use your hands to bring your head back to the center too. Yeah. And then I'd like for you to please extend your right leg out long. Just let it rest on that bolster. And take your left hand behind the back of your head. Your right hand is going to reach for your left knee, and you can bring your knee to meet your hand. You could also hold your thigh, by the way. Now bring your elbow, your left elbow, toward that left knee, and use your hand, your left hand, to pick up your head and pull your elbow towards your knee. You could also use your right hand on your knee to help. And then rest your head in your hand as you gently return your head to the blanket. Bring your elbow to your knee to your elbow. Feel yourself make a double chin. And then slowly release. 2 more. And you might be feeling some sensations here. And you've learned, your systems have learned that those sensations could be dangerous. But what I want you to know right now is that they are not dangerous. It's safe for you to feel things in your neck. We just need to have a little less fear so that we can have a little less sensitivity. Next time your head comes all the way down, land your foot again onto that bolster. Bring the sole of the left foot to the inner right thigh. So your left thigh is going to open up with your shin on that bolster. Hopefully that's okay for you. If you need something else under your left thigh, though, grab something, put it under there if that's too much opening for your hip. And then with your face turned to the right, take a handful of your mat in each of your hands and really slide those hands down as much as you can. Slide them down. So your arms are fully extended. Yeah. And then open your chest, shrug your shoulders back and down. So you're in a little bit of a back bend and your face is turned to the right. Gently turn your face back up to the ceiling. Tilt your chin up, 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 and then arc to the right. Nice and easy, chin back. And by the way, you're holding on to that mat the whole time. Lift your chin, arc it to the right. Do 2 more, holding on. So by holding on and pulling, we're adding a little bit of tension to these muscles that are already tense, right? Because it turns out the best way to get a muscle to release is not to stretch it, especially if it's already sensitive, but instead to find a lot of nice, healthy, beneficial activity in tandem with the breath. Let's do 1 more. This time, soft palate rises as you breathe in. Soft palate rises as you breathe out and arc. Come back to the center. And then release. Oh, release the mat from your hands. Shake out your fingers if you need to. I know that was a lot of work. And take both of the legs now long. So left leg long, right leg long, arms resting by your sides, and just take a few breaths, noticing any differences side to side. And whatever sensations you're feeling, my friend, they are safe for you to feel. Your neck feels stuff. It's supposed to feel stuff. You were endowed with sensory architecture to let you know what's going on with your neck. But when you've had pain for a long time in your neck, those sensations get even more amplified. We get very, very sensitive. Essentially, the brain is paying too much attention. It's not ignoring stuff that isn't dangerous. So by doing these movements, these gentle movements, even more assertive movements with the breath, we're teaching the brain, we're helping ourselves to learn that all these sensations are safe. Now, please bring your 2 feet once again flat onto that bolster. Onto that bolster. Arms are just resting by your sides. Gently turn your head to the left. Don't go any further than where you feel very comfortable. And if you have to poke into discomfort first to figure out where it is, that's okay. That's allowed. So once you've established how far is too far for now, you're just going to maybe limit the movement. It's not dangerous for you to poke into discomfort, yogi. It's not dangerous. Your body is so resilient, so strong, so strong. We're just staying away from it at the moment. We'll get there. It's not dangerous to have these sensations. They're normal. They're just a little bit exaggerated, which is what we're working on right now. Okay. So now keep your face turning up. Keep your heart turning up. Push down into that right foot and lift your right hip. So try not to tilt your heart, your chin, or your nose to the left as your right hip lifts and your hips tilt to the left. I know it's hard. And then let that hip settle back down into the floor, and we'll do it again. Let's do it about 3-4 more times. And you may notice that the act of keeping your face divorced from the position of your hip causes a fair amount of tension. It's okay. It's okay. You are capable of doing that. That tension is normal. However, when we can allow the spine to work as a unit rather than in segments, we do tend to feel a little bit more comfortable, and we also tend to be a little bit more skilled functionally. So how's about it? This time, when your foot pushes down, your hip tilts, so does your heart, so does your face. You might need to get your left arm out of the way. And then when your hips return, everything else returns. So imagine that your head is only turning because everything else is turning. It's not doing anything on its own. Let's come back to that breath, that palate lifting inhale. It almost feels like the beginning of a yawn. Palate lifting exhale. It almost feels like the beginning of a smile. Palate lifting inhale. Palate lifting exhale, like you might smile. This time, when your knees and your face are turned up, take a handful of your yoga mat with your right hand and make sure there's already some tension on the arm so the elbow isn't bent at all. That won't do anything for you. In fact, you probably won't like it very much at all. So make your hand as far down as you can so you're already feeling some tension on your arm. And when your hips, your heart, and your face turn, you're holding and gripping tightly onto that mat, and you might get a little extra sensation. And maybe after the first couple, you're like, I'm gonna have to bring my hand down a little further. You might also try keeping your right shoulder blade as close to the floor as you can. That's gonna really target some of these areas that get super sensitive. Trying to keep that right shoulder blade down if you can. Allow the head to turn. Okay, so remember how important the breath is. Without the breath, this is all just going through the motions. It's unlikely to be very effective at all. So if you can come back to that almost yawning inhale, almost smiling exhale, go for it. Do it. And the next time, your knees are to the right, your face, your heart, you got a lot of traction on that arm with the right shoulder blade moving down toward the mat. Pull on the mat with your right hand. Pull on the mat. So you get a big engagement of your middle upper trap. Maybe some scalene activity. Hold. And then settle your right shoulder blade to the floor. Reach your right arm out so you're no longer holding the mat at all. And you might need to shake out your hand a little. Face is still turned to the left. Push down into the inner right ankle to turn yourself even a little bit more into that twist, and then just release. 3 more. And you might notice there's a lot more sensation on one side or the other. This is totally normal. Totally normal. There's no way you're going to have everything the same on both sides of your neck, okay? So don't hold yourself to an impossible standard. That's in no way healing or affirmative. Next time, You're pushing into the ankle, you're turning a little bit more, your right shoulder so heavy. And then release that pushing down and just hold in your windshield wiper. As you inhale, find the beginning of a yawn. You feel the top of the mouth lifting. As you exhale, top of the mouth lifting. And I'm going to add on. Feel the basement of the throat drop. So the roof is lifting and the basement is dropping on your inhale. And on your exhale. It's kind of challenging. So let me give you another few breaths to try that out. The roof is lifting, the basement is dropping as you inhale and exhale. Almost like you're creating this long, narrow column. One more breath. Take your two hands to the sides of your head. As you release the windshield wipers, your hands return your head to the center and maybe slide it back to the middle too. This time, the left leg extends out over the bolster. Your right hand is behind your head, your left hand to your right knee. Bring your elbow up toward your knee, and then use the movement of the arm, the elbow moving to the knee to lift up. Maybe tap the knee with your elbow, and then let your head rest in the hand as you lower back down. Let's do 4. How much can you let your arm do? In your core. Again, the neck is capable of doing all sorts of movements independently, of course. But we tend to be more comfortable and we tend to be more functionally skilled when we work globally, when everything works in service to the same goals and aspirations. In this case, bringing your elbow to your knee. Okay, next time you come down, you're going to stay. You bring your right foot flat. Bring the sole of the foot all the way up to the inner thigh. Yep, let that right thigh open up, resting on the bolster, and maybe you need a little something extra. Maybe your thigh doesn't even want to be that open, okay? Take both hands, take to the sides of the mat and get a big old handful, maybe even shrugging down a little bit initially, so your hands are really, really low as possible. And then shrug your shoulders up, back, and down, so the heart is lifting. Heart is lifting. Turn your head to the left, nice and gentle. And with those hands gripping the mat, they're pulling a little bit too, right? So the mat is sort of holding this traction, but your arms are pulling. So we're working from a position of strength, which is far more likely to be interpreted by the brain as safe. Whereas if you just start wailing on your neck and doing a big stretch, it's more likely that your brain will interpret that as a dangerous movement that needs to be limited. Which is why when you finish stretching your neck, you often feel worse because your brain is like, oh my gosh, we have to make that stiffer. What is going on? Let's do 2 more. You're going to find that roof lifting, basement dropping breath. One more. Good. And next time you're back in the middle, you can release your grip. Release your grip from the mat. And just shake your fingers out a little bit, wiggle if needed. Now send your right leg out long as well. So both legs are fully extended on the mat. Adjusting any way you need to be comfortable, back to a neutral position in your Shavasana. And come back to that breathing practice For some of you, this may feel a little bit like ujjayi. So the roof of the mouth lifting, the basement of the throat is dropping as you breathe in and out. And I'm going to add on again. This time, feel your inner ears narrow, drawing in. So you feel like you have a very narrow column straight up and down the center of the head and throat. So ears are moving in, roof is moving up, throat is moving down. And sometimes we try to release it on the exhale. And if that's what you need to do, you're welcome to. But if you can keep that narrow column of breath for the in and the out, please do. Two more. One more. And then relax. Allow the breath to return to any kind of strategy, the most relaxed strategy possible. And take a moment to notice any sensations, feelings that might be present. And again, acknowledge that every single one of them is valid and important in this learning process. In this learning process. Ultimately, pain care is about learning. And you and your body are both the teacher and the learner. So often we do a practice like this and we expect to feel better. And sometimes you do. Sometimes you engage in your practice and you have relief. And you think, okay, this is some kind of magical practice that I need to do over and over and over to get relief. And that may be true. But you'll probably find it at some point, sooner than later, that you don't always get relief. Because pain care isn't always about immediate relief. It is about long-term learning. And if we can be consistent and we can keep teaching the body and the brain, the nervous system, how to be less sensitive over time, that's where we find our results. So allow all the feelings to exist, acknowledge their validity. I invite you to stay here in your Shavasana for as long as you're able. Continue to breathe, continue to notice, acknowledge. Thank you so much for practicing with me. Namaste.